evening, members of the board and all the community members. I am Nurse Morris, and with me are my fellow colleagues, Nurse Brown and Nurse Swaby. Today we are here to educate you a little bit about human immunodeficiency virus, HIV, and acquired immunodeficiency syndrome. So HIV is an infection that attacks the body's immune system. AIDS is the most advanced stage of disease. HIV targets the body's white blood cells, weakening the immune system. This makes it easier to get diseases like tuberculosis and some cancers. HIV is spread from body's fluid of an infected person, including blood, breast milk, semen, and vaginal fluids. HIV cannot be spread by kisses, hugs, or sharing of food. So you don't have to be scared to share your food with someone. However, HIV is contracted by having unprotected sex through oral, anal, or vaginal. AIDS, acquired immunodeficiency syndrome, is an ongoing, also a chronic condition. So untreated HIV leads to AIDS. HIV without treatment or proper care will potentially lead to AIDS, which means your immune system will severely damage. It will become deadly, hence the urge to get treated for HIV immediately after you're notified that you're infected. So, if you are infected and you don't get the proper treatment, that's when it leads to AIDS. So always remember, HIV is the infection and AIDS is the virus. So again, untreated HIV is lead to AIDS. How to evaluate their workplace to ascertain safe working conditions. When at work, always ensure to sanitize before and after every task. One should always wear proper personal protective gears like gloves, masks, or other barriers when assessing anything that might come in contact with blood or body fluids. Immediately wash hands after dealing with blood or body fluids and be extremely careful when using or disposing sharp tools during and after use.
How to demonstrate compliance with organization's infection control policy. Prevention and control in general. Patients receiving health and social care are at risk of developing infection as a result of their compromised state of health, underlying medical conditions, and as a result of contact with healthcare interventions such as surgery, diagnostic testing, or invasive devices. In addition, health and social care settings can provide ideal conditions for microorganisms to be transmitted between those who receive and give care. So we have to be very careful. The close proximity and contact between each party and the continuous contact is in a shared working and living environment or contribute to transmission. The practice as an infection control lead to whom any concern should be reported. The essential principles of infection prevention controls are hand hygiene. As my fellow co-workers stress on it, we have to always wash our hands before and after handling patients. Using personal protective equipment, we have to use our PPE. Safe handling and disposal of sharps. meaning the needles and the razors or whatever. We have to dispose of those properly. Those that are to be sanitized, we have to sanitize it accordingly. Safe handling and disposal of waste. Spillage management. I thank you.
How to develop and implement a personal risk production plan. Get tested for AIDS. Choose less risky sexual behavior. Use a condom, pinch, leave an inch, and roll. Limit to one sexual partner. Get tested and treated for STD. Talk to your healthcare provider about pre-exposed prophylaxis preps. Do not inject drugs. Identify the first step in any risk mitigation plan is risk identification. Thank you.
To assist their organizations in establishing the role the workers and facility will play in the prevention and control of HIV/AIDS. HIV as a workplace issue. As a workplace issue that impacts on productivity and the country's development, and also recognizes that it should be treated like any other serious illnesses or conditions in the workplace. It is also a workplace issue not only because it affects the workforce, but also because the workplace can play a vital role in limiting the spread and the effect of the HIV/AIDS epidemic. Non-discrimination, meaning we do not have to discriminate persons with the virus because we won't catch the virus. We don't want persons to feel less than we are. So we're going to treat persons equally, gender equality, whether male or female. We're going to treat each other just the same. Not because the person is a friend, we're going to treat Tom Brown different from Mary Jane. We're going to treat each persons equally, whether male or female. Healthy workplace environment. The workplace environment must be as healthy and as safe as possible for all concerned parties, meaning the workplace must be safe for the nurses or also the patients with the virus.
In addition to the HIV guidelines and policies, we also have social dialogue. At no given time, if the person is infected with the infection or the virus in a workplace, at no given time, your voice should not be heard. We also have non-screening. There is no injustification in having HIV or AIDS. So at no given time, your employer is to request your HIV status. Then we have confidentiality. If one chooses to go to your employer and say, boss, you know that I am HIV positive, your boss should not go and tell another employee. He should keep it between him or hers. They should keep it, however, to him or herself.
Continuation of the HIV guideline policy. Continuation of employment. There is no need to terminate your employee because of HIV status. Because you cannot catch AIDS by touching a person. Prevention. Teach them how to eliminate multiple sexual partner. Use a condom, which leave an inch and roll. Get regular tested to find out their status. Care and support. You can contact your caregiver if you found out that you have any STDs or illnesses to find out your status. And you can speak to your employee about any problem that you have. So basically this is it.
This is Nurse Stephanie Chang, and she'll be demonstrating the hand washing technique. Proper hand washing is one of the simplest ways to prevent the spread of germs and illnesses. Here's how we can ensure we do it correctly. Step 1. Wet your hands. Begin by turning on the tap and wetting your hands with clean running water. Apply enough soap to cover all hand surfaces. Lather your hands. Rub your hands together to create a lather, ensuring the soap covers your entire hand surface. Pay special attention to the backs of your hands, between your fingers, under your nails, your thumb, and at least 2 inches above your wrist. Scrub for at least 20 seconds. Continue to scrub all surfaces of your hands for at least 20 seconds. If you need a timer, hum to the tune Happy Birthday twice. Step 4. Rinse your hands. Rinse your hands thoroughly under clean running water to remove all the soap. Step 5. Dry your hands. Dry your hands with a clean towel or paper towel. If you are in a public restroom, use a disposable towel to avoid cross-contamination. Use a towel to turn off the faucet and open the door. Step 6. Dispose of the paper towel properly. Dispose of the used paper towels in a trash and maintain cleanliness and hygiene. Remember, wash your hands regularly, especially before eating, after using the restroom, after coughing or sneezing, and whenever your hands are visibly dirty. If soap and water are not available, use an alcohol-based hand sanitizer with at least 60% alcohol. By following these steps, we can effectively reduce the spread of germs, protecting our health and the health of those around us. In conclusion, try by focusing on HIV/AIDS prevention and practicing proper hand hygiene, we can create a healthier, safer environment for everyone. Let us all commit to these practices, not just today, but every day, to safeguard our well-being and that of our community.
Again, members of the board and all the members in our community, I hope all the information that we're gathered here today educates you a little bit more on HIV and AIDS status. And I hope you all are protecting yourselves and your partner, and I hope you all have a blessed day. On behalf of my fellow colleagues and the Older Bay Community Center Allied Healthcare, I thank you.